when I got assigned to the floor, my first floor was a medical ICU. They were all kind of the same as a COVID floor, but this one was a more, these patients were worse, I guess, per se. My first patient that I walked into their room, I don't think anyone had seen him in 2, 3 weeks. I mean, he had dried feces all the way up his back. I mean, some of these patients, you could see their spinal cords from bed sores that they were just left. We've seen the pictures of the IV poles outside of the rooms. They weren't assessing them, just kind of leaving them to die. And in the consensus among everyone was, well, they're going to die anyway, and there's no more humanity. And like, that was my first experience, like my first day. And um, I was, I felt like I was in a dream or like some sort of horrible nightmare.
To August of last year, nobody really knew who I was.
There's about 12 people who are producing 65% of anti-vaccine misinformation.
We need to come together as Americans and realize that we have a war at hand here.
Right? Like, dude, how scared of this shit do you have to be to be wearing gloves, a face shield, a mask at this point?
Help us to urge folks and say to them, look, it's time to roll up your sleeve and get the shot.
Chiropractor in Omaha, Nebraska, responsible for 65% of the anti-vaccine misinformation. Put what I say to the test. Just don't write me off as crazy misinformation.
Doctor, please bring yourself in order.
600,000 people will die of cancer. 300,000 people will die of obesity this year. When is enough enough?
Erin, how the heck are you?
I'm good. How are you, Doc?
Good. You're just moving and shaking these days.
Yeah, it is. It's good. It's a good thing.
Well, tell me where you're at these days and what you're up to.
Well, I'm still in Florida. I have kind of created, I don't know, following my passion in real healthcare, and opened up a functional medicine practice here, and it's going really well. Like, it's actually quite rewarding, actually helping people. So I've kind of tamed down social media a little bit, and like traveling and speaking and kind of starting locally, so busy raising 3 boys too. So just being a mom on the small end of things, right?
So you have 3 boys? You said?
16,
what are their ages?
13, yeah, 16, 13, and 11.
Oh, that's awesome. I have 4 boys, so it's good. I have one daughter, so 5 kiddos. So it's a lot of fun. It's like what, Jim Gaffigan, he stated that, what's it like having 5 kids? Imagine that you're drowning and someone throws you a kid. It's good. But
Exactly.
But life is good. Kids are a blessing. But I'm super excited to be sitting down with you. You were in our documentary, so thank you for your contribution there, and and just getting your story out there. And I think so many people need to, I don't want to beat the dead horse here and just constantly talk about crony baloney, but we have so much to talk about, and we need to talk about what happened during COVID, and just people like yourself that were, in the trenches, that saw firsthand what was happening during COVID. And what caused you the convictions that led you to speak out. What did you see? Because, so I just had this conversation yesterday with a gentleman, and, we talked about how 99% of the deaths occurred in the hospital, and it was due to these faulty protocols. So, Erin, I want you just to give a little bit of a backstory of where you were and what the trenches you were in. I believe it was in New York, right? What you were working in New York, what you saw. So let's give us a little bit of a backstory on that.
Yeah. Well, gosh, I cannot. First of all, it's been over 5 years now. I mean, it's crazy. Just how much time has passed, and how it's still not. People still are just figuring things out, But originally, I mean, look, working in the emergency room in Florida, I was put out in the tents, if you remember those. And, we had a few people come in, most with anxiety, right? Like and then they start thinking that it's COVID, they're scared. And that was like the majority of the patients that we saw in Florida. Our hospital was empty, essentially. And then another nurse had told me that they're looking for travel nurses to go to New York. So I I thought, that's the perfect opportunity to be able to help. And so I applied, and the way that they did it is kind of a lottery system. Do you remember back in the day when you called in the radio show to get through, right, the busy lines, and then you finally get through it? That's how that was the process of how they recruited nurses. So they took 400 nurses every single week. So I tried for 2 weeks, and on the third week, I finally got through. And they never really asked much about my credentials. They just asked if I was a nurse, and I said yes. And then they said, all right, get on a plane in 2 days, be here. So that's how they recruited nurses. I mean, I could have walked in, we gave them our credentials when we got to the hotel. Marriott Marquis in Times Square is where I was placed, and just handed them our license and that, but nothing was really verified. And that's how now we know there was a lot of people that were unlicensed working as well. As time goes on, more information comes out, and it's mind blowing to me. So a school nurse, would be working in an ICU with no ICU experience whatsoever, and that was fine as long as they had, something going on. And then there was nurses that weren't even credentialed at all, not even nurses that were there, which is
Goodness.
mind blowing. So think about that, just that, like the education, like they didn't really go through it. But when I did get there, I mean, I was sitting around for days and started talking to other nurses. They were there for 2, 3, 4 weeks, and just hanging out, getting $10,000, shopping. CVS, Walgreens, Target, all that was open around there. So that was kind of my first like moment that I'm questioning it. I thought that they were in dire need of nurses, but now I know that they were doing that to show that they were needing more and more nurses. Essentially, that was FEMA money, right? So nobody knew where anyone was going, and if the world knew that the majority of every 400 nurses they were pulling in every week was just sitting around twiddling their thumbs, I think like a lot of people would be quite upset about that. So I did get my assignment at Elmhurst Hospital, which was the epicenter of the epicenter that was in Queens.
We'll be right back after a word for our sponsor. This episode is sponsored by Ezra Healing, a leader in the emerging wellness paradigm taking shape across North America and beyond. People everywhere are recognizing that the old sick care model, quick fixes, symptom chasing, and surface level solutions simply isn't enough. Ezra Healing is a part of the shift toward truly patient-centered care that prioritizes well-being, integrity, and a do-no-harm approach. At Ezra Healing, your whole lifestyle, rhythms, and patterns are considered to better support the interconnected systems of your body. They're focused on real solutions, long-term health promotion, and prevention, an evolving grassroots movement dedicated to helping individuals and families live healthier and more resilient lives. If you're ready for a wellness experience that puts humanity first, Ezra Healing is guiding the way. To learn more, visit them at www.ezrahealing.com. And now, back to the show.
That hospital has a long-standing reputation for not treating patients right, and that was within the New York City health and hospital system, which is all Medicare and Medicaid, lower income population patients. So that hospital system, there's multiple hospitals in it, was really the only one affected in New York. So if you went to Manhattan, the private hospitals, they were empty, nothing like that was happening. So
I remember that.
Yeah.
And I remember that a lot of those hospitals, especially like the tents they had outside, they were all empty.
Yeah.
They didn't have a single patient. I remember following it, and they were censoring that information. They didn't want people to know because they're like, stay home, 2 weeks to flatten the curve, nothing you can do, stay at home. But those hospital tents were there just to scare the people, I believe. And you said the hospitals were empty in the pinnacle of this pandemic. Walk us through that.
In Florida, yeah. I mean, I'll tell you, the hospitals could have been empty in New York had they not admitted every single person that walked through the emergency door. So the way that they did it, we had the what was the ship called again? Gosh, I can't even. The Comfort ship, right? They docked that. Trump docked that for patients that didn't have COVID. So that ship stayed empty, and I would run after or before my shifts every day just to get some exercise outside of the hospital. I would run past that ship every day just to see, and it was always empty. So that was meant to be for patients that didn't have COVID. Anything else it didn't matter in these hospitals. Like, the process was they walked through the doors, they would immediately get admitted. They'd shoot them up with a dose of Haldol, which is a sedative, in order to get their respiratory tanked. And then that would qualify them for the floor. So that's where they would end up. Didn't matter if they had COVID or not. That was just the protocol per se. So um,
Erin,
then
what was the drug that you mentioned?
it's Haldol. It's a sedative. They would give them
Is that
like
the
a
drug that
very
is that the
sorry.
drug? I'm sorry to interrupt. Is that the drug that, like, if you were on it more than 48 hours, was a contradiction because it was caused respiratory failure?
Yeah, I mean, even a dose of it, the dosage that they were giving people would immediately just tank their respiratory system.
Gosh, and
Yeah.
how do you spell it? It's Helda?
Haldol.
Okay, yeah, and that was the drug that was given. I remember reading or listening to that in the documentary Vax 3. They were talking about how that was the drug of choice, and there was a massive warning on that drug. People,
Mhm.
and they gave it like the max full dose, beyond the warning. It was like every day they gave this drug, and then it would cause respiratory failure, and then boom, ventilator remdesivir. It would like create this perfect storm.
Yeah, it was an intramuscular injection in the emergency room. I mean, we rarely use that even in, like the everyday world, right, of medicine, but that was the injection of choice. And they would give it to calm these patients down. But what it did is it tanked their breathing. Then they would ship them up to the floors where they would later be put on a ventilator, whether or not they had COVID, because it was a precaution. And then, from there, it was more sedatives, paralytics, and no treatment, really. I mean, when I got assigned to the floor, my first floor was a medical ICU. They were all kind of the same as a COVID floor, but this one was a more, these patients were worse, I guess, per se. My first patient that I walked into their room, I don't think anyone had seen him in 2-3 weeks. I mean, he had dried feces all the way up his back. I mean, some of these patients, you could see their spinal cords from bed sores, that they were just left. We've seen the pictures of the IV poles outside of the rooms. They weren't assessing them, just kind of leaving them to die. And in the consensus among everyone was, well, they're going to die anyway, and there's no more humanity. And like, that was my first experience, like my first day. And um I felt like I was in a dream or like some sort of horrible nightmare, because how on earth are my colleagues allowing that? Like, how does everyone go along with it? Like, how do you look at that as a medical professional and be okay with it, regardless of the majority going along with it, like in your heart and soul, And I actually dropped to my knees when I got to the hotel room, and I just bawled and I prayed. And then I just knew that I'm like, all right, I got to do something, I can't, either I go home or I remain a part of this, and, or I do something about it. So I did. So that's when I contacted a couple attorneys, and I'm like, what do I do? And we started recording. I got some recording devices, the spy glasses, mailed to me, shipped to me. My attorney shipped them to the hotel that I was staying at, and that's what I started doing. And in the meantime, just trying to save as many as I could, which there was one man that survived. But other than that, everybody else, you know, their lives were taken from them unnecessarily. So
God bless you, Erin. I know it's people like you that really had a massive impact on getting the truth out there to the people about their protocols. I remember my mom having a diabetic episode. She wouldn't do, she had blacked out, and they took her to the hospital by ambulance. And, and I remember calling my dad, and I said, you need to call the hospital and tell them absolutely no remdesivir, no protocols, no medicines, and so finally he called, and the doctor, when mom came out of the diabetic, or basically this diabetic episode, the doctor threw his hands on my mom's face and said, "What's the deal with remdesivir? Why can't you be on that?" And she's like, "I don't have COVID. My blood sugar was 500, and this is why I blacked out." So I wonder how many people died unnecessarily due to these protocols. I mean, if you had to guess, and
All of them.
it had to have been, yeah, right.
I mean, really, all of them. And I don't say that lightly. Like they could have. We treated. That's when I opened America's Clinic with my partner, Dr. McKenna. We have helped every single patient that has seen us, and this is our telehealth with the ivermectin, protocol, and like actual, real functional medicine, right? Like vitamin C. They were laughing at that. I mean, all of this. There's not been one unsuccessful patient that we've ever seen since we opened in December of 2020. So it was the protocols, and just the lack of care and compassion, and people not.
Where do these protocols? Sorry, Erin, where do these protocols come from? Was it from Fauci?
I don't. Yes, Fauci. I don't know who came up with it. To be honest with you, I don't know who came up with it. Fauci, yes, everything points to him, but it was weird because it was already set in place, and that was part of something I recorded when I was in there. That's actually on the documentary. I was questioning. He was actually a cardiologist that was working the COVID floor that I was on, and I asked him, like, why can't we do anything else? He goes, because nothing else works. And I had brought up, well, what's the point in trying? Because when I was there, 100% of the patients had died. So I'm like, obviously what you are doing isn't right. He's like, it's just the protocol. So since when do we just follow that? I mean, it was the government created the protocol. And like they didn't allow doctors to be doctors and nurses to be nurses. And that's why I always said, like, if they wanted to create these protocols and tell us what to do, then they can go get a medical degree, right? So administration in the New York City health and hospital system was like thoroughly enforcing it. We couldn't even get alternative medications if we wanted to. I mean, it's disgusting.
Right. And so when you were getting your story out there, did you ever sense or experience censorship?
Yeah. I mean, it's been really, really hard, honestly. I mean, I lost, obviously, like my social medias multiple times, rebuilt them up. I've been banned from PayPal, from Stripe. There's a couple EMRs, even when trying to like build our like telehealth platform and our functional medicine center, that they don't allow us to use. So, I mean, the censorship is part of it, right? It's the truth and they don't want it out. So they want to stronghold anybody that tells the truth and try to destroy them, but not everyone can be destroyed. I mean, you just have to keep getting up again, but it's not easy, especially trying to also live your life, right? Like I still am trying to raise my kids and that, and like obviously financially it's not been easy, but at least I know I'm on the right side and I can sleep at night, like it's not life isn't always supposed to be easy. It's not, it's doing the right thing regardless of how hard it might be, because we'll always come out.
Right. Just as the Bible says, do not conform to this world, right? And conformity is what everybody else is doing, regardless to what your convictions are, what is right. But you had the courage to do what is right, regardless to what everybody else was doing. This is why I'm sitting down with you, because that's, in my opinion, the definition of a hero, definition of someone that stood in the gap. And if you weren't censored and during crony baloney, then you weren't on the right side of history.
We'll be right back after a word for our sponsor. Today's episode is sponsored by Ezra Healing, a place devoted to renewal and deep-rooted well-being. Ezra Healing supports individuals and families in soothing the nervous system, releasing accumulated stress and trauma, and restoring the body's God-given ability to repair and thrive. Their method is gentle, discerning, and grounded in honoring how the body was created to function. With steady guidance, thoughtful education, and practical resources, they come alongside each person to foster safety, resilience, and whole person healing. If you're seeking a space to breathe, rebalance, and truly heal, Ezra Healing offers a powerful path forward. To learn more, visit them at www.ezrahealing.com. And now back to the show.
It's I also experienced that. Did PayPal permanently ban you?
Mm-hmm.
Out of curiosity? Yeah, same
Yeah.
here. They took my account. They seized my money. Or actually, for our documentary, they seized my accounts. Do you remember when PayPal was like, hey? Yeah, so they seized our funds.
Wow.
Seized our account. They permanently banned my Venmo. So we lost a lot of our contacts. We had Venmo. We had all those accounts through there, and we lost all those contacts when they seized the accounts. We couldn't even get into them. But they also said, do you remember when they said, hey, we're going to fine people $2,500 per violation of misinformation? Do you remember that? Or disinformation?
Yep.
Yeah. They got a lot of backlash for that. So I thought that was pretty comical.
Mm-hmm.
But you were one of the few people I know that actually got their accounts seized just as well as mine. So it's just, I want people to understand that, that medical tyranny is a real thing. And what we experienced during COVID was not just how do you say it? It wasn't an accident. It wasn't just just a freak of nature that we just had this pandemic. This was an agenda to really push the Hegelian dialectic, problem, reaction, solution, to funnel in a lot of tyrannical measures from a legislative standpoint, from a health standpoint. This is why it's so important that we have medical freedom into our Constitution, that we empower the greatest of minorities, and that's the individual, especially when it comes to healthcare, the nurses, the physicians out there, and allow them to practice the way they should without putting the patient obviously in harm's way. But on that note, have you seen any justification with these measures that were in place? Have you seen any justice being served here, or any vindication?
No, and that it's tough because even with all the lawsuits, the justice system is just as corrupt. And if you don't dot an I or cross a T, you're sent back, and they're just postponing. And I don't know. We haven't. And honestly, we were wrong would be nice, right? But no, there's not, and they just keep moving on, and look at what's going on with now, like the COVID vaccine. They've finally, I think they're putting a black box warning on it now. I think that was part of it to usher that in. What we are seeing is a ton of cancer right now. And that is, just yesterday, we have 3 more cancer patients. We're perfectly healthy, and they're connecting it to that vaccine. So it's like, we're still dealing with this, right? And there isn't any repercussion on their end. And that's what's so tough, because they're so powerful and have so much money, and that's why they remove our financial ability, right, to just make it much easier for them to continue the takeover, is like what I like to call it. And who do you call? Who do you trust? The FBI was at my door harassing me for over a year and a half for my videos. So it's the scare tactic,
Right.
But yeah, I think that's exactly why there's not a lot more whistleblowers too, because they use people like me as an example of like, this is what we'll do to you,
It's
yeah.
criminal. So are
It
you in any legal battles now?
Yes. Yeah. And they're not moving. That's the problem. And honestly, I've also had a lot of attorneys that are just as corrupt, you know, and I know that's happening with like a lot of widows and widowers as well, trying to get justice because there's attorneys, you know, swooping in saying that they're going to help them. They give them a bunch of money and don't do anything. So it's really, 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 really hard for a lot of people to be able to get the justice that they need because it's just there's just there's good people, but there's also a lot of there's a lot of bad ones out there too.
Erin, tell me about your lawsuit. Can you talk about it?
Can't say a whole lot about it, but it is in process right now, and
when did you file?
We filed back in 2020.
And it's still not moving.
It's not moving.
Wow. I feel like we're on parallels. When you said that, I just struck a chord. I filed 2 lawsuits, one with Bobby Kennedy. We're going on 3 years and there's no movement. Even the DOJ, the Department of Justice, backed us in July, and this lawsuit's still not going anywhere. It's just, there's a common theme here. Where did you file it in Florida?
New York.
New York. That's probably why. Or do you have multiple plaintiffs?
Yes, there's a class action. Mm-hmm.
Okay. Yeah, New York. There's something about New York that the tyrants love, because we filed multiple lawsuits, and every single time they always file a motion to move it to New York. And it's like, I wonder why. It's a corrupt blue state, and they have, I think, judges in their back pocket. So
no, they do.
Yeah, I pray that you get some headway there. And I know that, I'd love to have you back on, Erin, too, when we have more time to really dive more into some of this. And just, I really appreciate you coming on. And I know this is a kind of a shorter interview than what we do in the past, but I just love your heart. I love the conviction and courage that you showed during COVID. I'm going to give you the last final word of encouragement here for the listeners, for those people that are maybe stuck in a position or a similar position that they might see something that contradicts what they believe to be true, or maybe there's a check on their spirit and their heart. I just want to give them some encouragement on speaking boldly and living courageously, and give you the final word and put a plug in where people can find you.
Yeah, I think mostly, like, if you follow your heart and you do what's right and you follow that pull and you trust God is going to protect you, which he always does. I mean, I'm still here. I'm still pushing. We're still helping. Like I said earlier, like, life isn't meant to be easy. It's meant to be a learning experience. And if you can lead by example, especially if you have children, like, what better way to make a difference in the world, and a lot of people think like, well, I'm just one person, you can, I'm just one person too, right? And you can make a big difference in the world. So and honestly, it just feels good. It feels good to just let it out, right? And just know that you're on the right path, because this life here on earth is short, but eternity is forever, and you'll look back and be proud of yourself. But my website is nurseerin.org, and then our telehealth clinic is americasclinic.com. So if people ever need any medications, we have a cancer augmentation therapy program through our wellness center. That's where I just came from. So yeah, yeah.
Well, Nurse Erin, God bless you. NurseErin.org. I can't help but think of Matthew 5:10. Blessed are those who are persecuted for righteousness' sake, for theirs is the kingdom of heaven. Also, Matthew 5:11. I know you faced massive persecution, slander. I as well. But one verse that really encouraged me was this verse here in Matthew 5:10, but also even in 5:11. Blessed are you when they revile you, persecute you, and say all things, say all kinds of evil against you falsely for my sake. And so that is something that is encouraging. Well, Nurse Erin, God bless you. If you're listening to this episode, please share it far and wide. Tell a friend about it. Again, medical tyranny is at our doorstep. If we stay complacent, we're going to let them in the home. So we must be proactive in this fight. Share this episode. Medical tyranny is still very much active and alive today as it was in 2020. So stay active, be proactive. Again, Sam Adams said it doesn't take a majority to prevail, but rather an irate, tireless minority keen on setting the brush fires of freedom in the minds of the people. God bless you guys, and thank you for listening.
To August of last year, nobody really knew who I was.
There's about 12 people who are producing 65% of anti-vaccine misinformation.
We need to come together as Americans and realize that we have a war at hand here. Right?
Like, dude, how scared of this shit do you have to be, right, to be wearing gloves, a face shield, a mask at this point?
Help us to urge folks and say to them, look, it's time to roll up your sleeve and get the shot.
Chiropractor in Omaha, Nebraska, responsible for 65% of the anti-vaccine misinformation. Put what I say to the test. Just don't write me off as crazy misinformation.
Doctor, please bring yourself in order.
600,000 people will die of cancer. 300,000 people will die of obesity this year. When is enough enough?